Perfect, there we go. All right, so throughout this presentation, we are going to cover a myriad of things. I'm not going to go through this entire table of contents, but this is just so later on, if you're clicking through the slides, you know what will be covered in this presentation. All right, so DHED's mission, so DHED is committed to creating safe, affordable, and prosperous communities to live, work, and do business in Virginia. And to that end, the Homeless and Special Needs Housing Unit administers a continuum of state and federally funded homeless services programs to address housing and stabilization services for individuals and families at risk of or experiencing homelessness in the Commonwealth. And with that, I will pass it over to Ray.
Thank you so much, Taylor. So I'm going to go over I'm going to go over the main funding sources that we administer as DHCD, HSNH. Not including the COVID-19 CHIRP funding, we have three main funding sources. Can go to the next slide. Thank you, Taylor. For each of the funding sources, please note that they are each listed here. We have the Virginia Homeless Solutions Program, or VHSP. We have the Housing Opportunities for Persons with AIDS, HIV, or HOPWA. And we've got Housing Trust Fund, or our Homeless Reduction Grant. And thank you, Taylor. So these are the HSNH guidelines 22 to 24. Please note that there have been updates from our 2020 to 2022 guidelines. So just please make sure that your program is using the most current version that we have. Next slide. Thank you, Taylor. So the first main funding source that I will go ahead and review with y'all is our Virginia Homeless Solutions Program, or VHSP. This is really our bread and butter, our meat and potatoes. And the goals of VHSP are to assist households experiencing homelessness to quickly regain stability and permanent housing and prevent folks from becoming homeless. So really these activities are designed to reduce the overall length of homelessness in the community, reduce the number of households becoming homeless, and reduce the overall rate of formerly homeless households returning to homelessness. Next slide. Our VHSP eligible activities should look pretty familiar to y'all. I won't go through each of the bullets, but you can see the usual categories: outreach, coordinated entry, that's targeted prevention, emergency shelter operations, and so on. For our program participant eligibility, please note that eligibility varies by activity type or project type. For emergency shelter operations, you will also hear us list this as shelter or just ESO. Our eligibility requirements are that folks should be literally homeless, at imminent risk of homelessness, or exiting an institution that they resided temporarily with no resources or anywhere to go. For our rapid rehousing programs, our program participants will be literally homeless, individuals who were literally homeless prior to entering an institution where they resided temporarily and are exiting that institution with no resources or anywhere to go and have no other resources. For our targeted prevention program, our folks will be at imminent risk of homelessness. And when I'm saying imminent risk of homelessness, I'm specifically referring to within 14 days of homelessness. And these households will have an income below 30% AMI and have no other resources. I would like to note that this is specific for targeted prevention and not eviction prevention. Next slide. Thank you. For our grantee requirements for VHSP, we are looking for folks to operate with a housing first lens. We're looking at folks to have case management best practices. We are looking for a genuine harm reduction lens, authentic trauma-informed care, and you can see the list here as well. And the next few slides will also go into each of these bullets in more detail. Next slide, please. Thank you so much. So for housing-focused case management, What we are really talking about here is we are looking for clients to receive housing-focused case management at least one time per month. There is no cap to case management. I've actually had that question a few times. And we are also looking to see that documentation of case management is in the client files. When we say documentation of case management is in the client files, specifically, we are looking at, are you conducting assessments with clients? Are you facilitating access to mainstream resources with clients? For example, food banks, diaper banks, things like that. Are you, monitoring and evaluating your program participants' progress? But also, are you developing and following up on individualized housing and service plans? I really want to highlight that individualized housing and service plans. All of our clients are different. Our housing and case plans should be created specifically to our clients. So because each client is different, each of your case plans and individual service plans should be different as well. On top of that monthly requirement for case management, please note that additional support services are voluntary and are not mandatory. So what that means is services like job interviews yes, job interviews. We cannot mandate folks to go to things like that unless it is client driven and it is within the client's best interest and desires, and they, share themselves that they would like that to be a part of their case plan. Next slide. So for equal access and prohibited inquiries, it is exactly what it sounds like. All activities must be made available without regard to actual or perceived sexual orientation, gender identity, or marital status. The next slides will also touch on this a little bit as well. So in relation to that last slide, we are also looking to make sure grantees are in compliance with fair housing and civil rights laws. I won't read these bullets, but I do want to just highlight the point that the Virginia Values Act that was effective July 1, 2020 did expand that list of protected classes under the Virginia Fair Housing Act. I've noticed in some folks like COC operation manuals or personnel manuals, things like that, it hasn't been updated. So just make sure that your programmatic documentation has been updated to reflect all of the protected classes. Next slide, please. So for the definition of family, what this means is really that you are serving families as they present. Family includes, but is not limited to, regardless of marital status, actual or perceived sexual orientation, actual or perceived gender identity, any group of persons presenting for assistance together with or without children, and whether or not a member of the household has a disability. Next slide, please. So this is also in relation to that last slide, prohibition against involuntary family separation. The age of a minor child must not be used to deny any family's admission to a family shelter. So what does this mean, right? If you have a single dad with a 17-year-old son, it is, we are expecting not to have that family be separated and not to have that 17-year-old son be sent to the single shelter. This also means that, let's say you've got a family presenting for family shelter and it is a mom, cousin, and child. That family should remain intact and be presented as and served as a family. Next slide. So for proof of diversion, all providers must engage households seeking homeless assistance in a problem-solving conversation to address the household's current housing crisis. Really, this means that we are looking to make sure that there are documented efforts of diversion. When I say documented efforts of diversion, I mean that this should include a discussion of alternative resources available to the household, including linkages to mainstream and natural supports, light touch assistance. We want to ensure that this is in the client's case file and it is clearly documented. We want to ensure that each COC and LPG ensures that each partner receives the attempted diversion documentation when people enter the shelter. As you all are very familiar with, we have an incredibly limited resource, so we're really trying to make sure that diversion attempts have been attempted. Next slide, please. And I will hand it off to our PM, Taylor Harvey Ryan.
Thank you, Ray. So we did want to go ahead and call out some of the major changes that have that we made in the guidelines specifically. So the first change that we made was fair market rent. And by this, we mean we inserted a waiver for fair market rent for all of our state-funded projects. So please be very mindful. Fair market rent still applies for our federal rapid rehousing project. When you go into the guidelines, you will see under federal rapid rehousing, it still specifies that you must use fair market rent. But for all other state-funded projects, which would include state rapid rehousing and targeted prevention, there is a waiver that allows you all not to use fair market rent. You, however, must still use for both federal and state-funded projects under our grants rent reasonableness. So please do not omit that because you're omitting the fair market rent. The next one, excuse me, is there was a switch in the guidelines and now we've switched it back. It said we went from area and median income to median family income. That was a mistake. We are actually still going to be using area and median income, so that has been corrected. So if you were super on it and you checked the guidelines as soon as they were up the first time, then you notice that there was a change. We are actually going back and it is area and median income. So you will continue to use the same link, the same everything for your area and median income. Next, we're going to talk about remittances. So most folks have been doing this excellently and we thank you. However, there are some folks who are doing it a little bit differently. So we just want to make sure we're consistent across the board. All remittances must be done on either a monthly or a bi-monthly cadence. And so on your remittance form, if you've already checked it out for this year, there's a drop down feature. Instead of you being able to key in the dates that you want to cover for your remittance, there's a drop down feature. You will select which month you are remitting for. All of your expenses must fall within that time frame for that month, or they can be before. So if it's, you know, your August remittance and you forgot a July expense, that's fine. You'd be able to put it on your August remittance, but you could not go forward and try to put a September payment date on there. It needs to be within the time frame of that remittance. If you have questions, comments, or concerns, make sure you reach out to your PA, and then they will be able to walk you through how to do your monthly remittance form. And then the next one, we removed the homeless certification form, and simply we removed that because we realized that we do not want clients doing duplicate paperwork, especially if it's giving you the exact same information. So now you will no longer do the homeless certification form, but rather do just the targeted prevention or rapid rehousing eligibility form. And then I will go ahead and talk about the risk mitigation fund on the next slide. Oh, well, we just went through the fair market rent. This is the same information that I just went through. You must still meet rent reasonableness, but fair market rent has been waived for state-funded projects. All right, risk mitigation fund. Risk mitigation fund is a new line item that we permitted under the state rapid rehousing only. So please be very mindful when you do your budget, it is only under state rapid rehousing funds. When you spend those dollars, it is only under state rapid rehousing. If you try to do it under federal, there's no line item there. So you'll just be struggling a little bit. So for the risk mitigation funds, we're doing this really to just improve outreach and engagement efforts between our grantees, the households that you all serve, and our landlords. So you can pay for the cost of repair of damages incurred by a project participant that are not covered by the security deposit. So this needs to be above and beyond what would have been covered by their security deposit. So please make sure if you're being billed for damages, etc., it's not within that security deposit. And or you can pay up to 2 months rent or until a vacancy is filled, whichever comes first, in situations where the tenant left before the lease ended. So both of these are supposed to be used in order to maintain landlord relationships and encourage them to continue to work with you all. Please also be mindful that any payment of risk mitigation funds must be counted towards that project participant's 24 months of assistance. So if you know your client is going to need 24 months of assistance, the risk mitigation fund might not be something you need to access because that does count towards their 24 months. All right, and now I will pass it to Sarah.
Thank you, Taylor. It's really nice to be with you guys. like Taylor said, I'm Sarah Foote. I'm Region 3's program administrator. So I'm just going to talk to you guys a little bit about the like nuts and bolts of the programs, specifically VHSP. Oh, hi, Laura Beth. So our first one here would be quarterly calls. Y'all are very familiar with these if you have been grantees before. If you are new, this is just something that we do to touch base as, I'm glad that people are joining the meeting. That's great. This is what we do just to touch base and make sure that grantees are making data-based decisions and check in to see how the expenditure rates are going for each of their projects. In this case, we're kind of focusing on VHSP, but if you also have other funding sources like COVID relief funds, we will sometimes touch in on those funds as well during quarterly calls. We also kind of explore the opportunity to just talk about community trends, how things are going in your localities. We know not every single area in Virginia is encountering the same challenges, issues, etc. So, you know, sometimes it's good to kind of get a pulse, see what's happening that might be squeezing the market in your area, or something that clients have been bringing up as an issue, or anything that might need some special attention. We, of course, are going to talk about funding during these calls as well, but it just kind of opens up the opportunity for us to get together as a COC or LPG, a local planning group, and discuss what's been going on in your communities. Next slide, please. Yeah, we're also going to go over real quick, just close out and start up on this presentation. So right now, those of you who have been grantees thus far are looking at your closeout for 2022. So we are still looking for some of these required documents. And so we're just going to speed right through those. If you're a lead agency, you have a couple more requirements for closing out your projects on behalf of not only your organization, but also your COC. So we're going to look for those actual match documents, and we're going to get into matches in just a minute as well as any audits that you might be missing, grant agreements, year-end reports. We go back and forth on these, guys. So if you don't get it all right the first time around, that's okay. We will work with you to get that data cleaned up. But we do want to impress upon you that it is important to get those in timely so we can have that back and forth without y'all falling out of compliance. And June actuals if you submitted June projections. Next slide, please. And then kind of on the other end of it, startup. There are a set of documents that are needed to get your project up and running and actually remittable in CAMS. So kind of before we can press go on your project on this end, we need to ensure that if you have shelter operations as part of your program purview, you're going to have those habitability standards, the basic habitability form. We'll actually get into that in just a second. Like we said before, just make sure your financial documents are up to date and in place. We need your signed grant agreement. That's before any amending happens. We just need to make sure that your grant agreement is good to go and that your executive director, program manager has signed it. The budget revision, it's really kind of just to make sure that your budget is entered into CAMS. We will walk through any sort of budget things that you might have questions on if you just want to contact your program admin, but this is something that you will need to put in yourselves. And that does have a 30-day approval period. So you submit your budget on, I'm just going to say July 15th. Let's just say you had all your other documents in. That means by, I'm not that great at math, but August 15th-ish, we should have it approved and good to go so you can start remitting for that project. It's important to note, you can start spending for the project, but we can't accept any remittances until your budget has been fully approved and you have these documents in place. Next slide, please. Yeah, so we mentioned this before, the habitability standards. If you have been a grantee before this and you do shelter operations, this basic habitability checklist should look super familiar. If it doesn't, we might have a problem, but it's never too late to get caught up. It's a little bit small, so we're not going to zoom in or anything like that, but there are a number of criteria on this sheet that absolutely have to pass inspection. Basically, like, do your lights work? Is your water appropriate? Like, Is your facility sanitary? Is it habitable for your clients? And we do kind of spell that out very specifically on this form. It is important to note that every shelter location that you operate has one of these in place. So if you are operating congregate shelter, you got to have a habitability checklist filled out, signed, and appropriately documented. If you're operating non-congregate shelter, you have to have one of these for each of those sites. I have a couple of grantees that operate non-congregate emergency shelter, and y'all have been really good about getting your non-congregate site documentation in. So this is just one of those things that wherever folks are living in your program, you need to be able to, demonstrate to us that the area that they're living in is appropriate, safe, habitable. Next, please. Yep, matches. So for each COC, actually for each grantee, but for each COC, 25% match is required for being able to receive and expend VHSP funds. This is based on the total amount of funds that are allocated to your LPG or your COC. So folks will sometimes turn in one that has like line items for each grantee, just kind of listing out that 25%. It has to be 25% overall for your COC or LPG. So like it says here, it can be met at the community and or the grantee level. There are several different ways you can get to that 25% match. Sometimes in-kind donations, volunteer hours. We need to have the dollar amount listed, like associated with those volunteer hours. Salary that's paid from other sources that are not state funded or, a duplication of services. If you have questions on this match requirement, or you're just feeling like, hey, my form that I've been filling out doesn't look like that form, please make sure to get in touch with your program administrator. We have these forms and we can provide them to you. That goes for all the forms, but I know match can get a little confusing sometimes. Next slide, please. Grant agreements. Here's kind of just the most basic requirement of all. Before a budget can come through, before anything else can happen, we pretty much need to have your grant agreement in place. That's just to indicate that you have a project with us, that you have been selected to disperse these funds as appropriate, and we are going to be the ones that are your funding source to come through. The grant agreement dates on the top of the grant agreement are going to say this year's fiscal year, right? So it will say July 1st, 2022 to June 30th, 2023. Yes, it makes sense that it says to June 30th, not to July 1st, 2023. It has to end on June 30th. Expenditures begin for your fiscal year, and by that, your program year on July 1st. So even if you don't spend anything until July 7th, 2022, that's okay. It's beyond July 1st. If you're trying to remit for something that happened June, 24th, that's a no-go, unfortunately, because that's not within the current fiscal year. So those grant agreements are, they're kind of the basic piece that lets your project live beyond that. And there is also a need for the agreement with, oh, thank you, Nichelle. That is a good, yep, no federal funds either. Yep, they cannot be used for a state match. I did not say that. Thank you for dropping that in the chat. The Hsnh agreement also with the lead agency must be filled out, signed, and put into CAMS before any of the projects can go through. So it's kind of a 1-2 punch there. Next slide, please. Now we're on to reporting. I am delighted to turn this presentation over to my colleague, Andrea Ukrop. Andrea, take it away.
Thanks, Sarah. Thanks everyone for being here to go through these things. So first I'm going to talk about the VHSP reporting requirements. So we have been working really hard to try to get the CAMS reports to be similar to HUD reporting requirements so that you're able to either run a coordinated entry project APR or a general project APR. So I think we may have a little bit more cleanup to do based on some questions that have come in this year, but you know, that's the direction that we have moved with CAMS. I will say, just to make sure everybody is thinking about joining the Homeless Data Integration Project, which we are getting probably a month or so away from, let me say about 2 months probably away from getting new agreements signed and starting with implementation. In the future, all reports that DHCD is going to require will be available to run out of the HDIP system. And at that point in time, we may be looking at other reports that may not be a standard HUD APR report to better look at outcomes and not just outputs. Let's see here. The updates that need to be made for January's reporting will take place, and other things that we require and will continue to require that I'm not sure you get out of HMIS is capacity and utilization of shelters at the end of year report, and rapid rehousing, and I believe our targeted prevention also has the length of financial and case management services, and those will continue to require that. I'm going to talk a little bit more about the SAGE ESG CAPER in just a moment, but that is something that is also required for those who receive ESG. Next slide. Okay, so reports are due 2 times a year. The first one would be due January 10th, and that would run from July 1st through December 31st. So that's you know, half the year we're taking a look at what's been going on, and then you have a full year, so you'll go back to July 1st to June 30th. All that report will be due July 10th. Hopefully everybody will get to celebrate 4th of July now and not be trying to get their end of year reports done on time. The other thing is getting if you're getting delays in your reports, this can put a flag on your CAMS project, and remittances will be delayed. If it's something we're going back and forth with, that's different. That time will be moved, right? But if they're just not being submitted, then that is going to cause remittance delays. All right. Okay, so I want to make a couple comments around the SAGE ESG CAPER. First, I'm going to talk about just very briefly about the year that we're in. If you have any issues getting your SAGE report uploaded or your CAPER uploaded into SAGE, please reach out to your program admin. They will get that information to me, and we will we'll figure that out. I work with another office, Lindsay Austin, to be able to make sure everything gets uploaded in there correctly. The CAPER is also due April 5th. So here's a change, and if you don't have your HMIS admin on the call, this is something that that we will make sure everyone is aware of, but please make a note of this. So when you are granted ESG, that needs to be one ESG project. So here are some instances that we have, and folks who are doing these things are the ones who are going to be getting in contact with us. So in the past, we have had, let's say, a rapid rehousing program that got ESG, but in HMIS, they had a family rapid rehousing project and a singles rapid rehousing project. That can no longer be done. It needs to be one ESG rapid rehousing project. There may be other cases where a city or county receives the ESG project and then subgrants that out. However, any project who is using that ESG money, they need to have the same HMIS project. This has been a HUD standard for some time. However, we were previously able to run out of HMIS a merged report for the CAPER. So that's no longer, so it can still be run out of HMIS, but it cannot be uploaded into Sage. So this year, if you find that problem, we have your solution, but next year it needs to be one project. So you can't match. Oh, we'll get to questions in just a second, I think. Maybe we should take some time to answer some questions. So you can contact me directly, but make sure you CC your program admin or contact your program admin if that's an easier thing to do. I know we're going to have questions on that, so I don't know if we want to take a break and just answer these CAPER questions or come back to them, Taylor.
Go ahead and grab those two.
Okay, let's see what we got. So Anthony was asking, so you can't match multiple projects in HMIS as one provider in Sage. It's done. I've done this for shelter programs for the CAPER. So in the past, we were able to have multiple HMIS projects that you ran as the CAPER and it would go into Sage. We ran into an issue and we reached out to TA, and I'm going to go through some highlights of that so we may understand it better. So for the regular ESG CAPER, HUD has always required that the recipient identify each project individually. So we have to be able to identify those projects. The projects that we are identifying is who we're granting that money to directly as one ESG project. This year, HUD began increased enforcing of that requirement, and Sage is now validating that there is only one project in the upload and not accept the upload if there are more than one listed in question 4 of your CAPER. So when your CAPERs run, question 4 is information on the projects, and if you have more than one project listed there, it will not upload into Sage. Okay. Yes, it would apply to shelters as well. And actually, shelters is the reason that they're enforcing it, because they go on to say, in ESG, it is not unusual for a shelter to be funded by more than one ESG recipient, city, county, state, or territory. When that happens, the same persons are being reported in more than one CAPER nationally. For HUD to attempt within reason to unduplicate, we must remove one of the projects when we do national counts. This is done using the project ID from HMIS and cannot be done if multiple projects have their data bundled together. So yes, it too applies for shelter programs. The region, how will provide both state and city. So you would need to have, you can have a VHSP ESG HMIS project, but multiple agencies will have to enter data into that HMIS project. And if you have city and state funding, they need to be in 2 different HMIS projects. Are there other, obviously you can ask other questions as you think about this, or there may be some COCs that need to get with their HMIS admins to work through this process, but sorry.
That's okay, Andrea. We'll grab the rest of the COC or the SAGE ESG CAPER questions at the end in the Q&A.
Okay, sounds good. All right, and we have one more slide, I believe. Okay, so we do look at HUD system performance measures, but the time that we look at these is during the application evaluation. So just as a reminder, when we're reviewing the performance of COCs for our annual VHSP application, we are looking at length of time homeless, first time homeless, returns to homelessness, and the point in time and annual count. So those are all HUD system performance measures that we take a look at as a COC. And just as HUD does, we look at the difference between the COC from the previous year to the new year. We're not comparing COCs against each other. All right. Oh, I'm sorry, and I'm going to turn it over to Darrell.
Fantastic. Thank you, Andrea. Good morning, everyone. Thank you for joining us, and certainly I want to thank our HOPWA providers that have joined us. Nichelle, I just wanted to say that the HOPWA team wanted to say thank you that we were finally able to locate your office yesterday after all this time, but we appreciate being able to tour your office yesterday, so thank you so much. Now let's move on. I'm just going to give some highlights here. Again, HOPWA, Housing Opportunity with people with AIDS. Again, the program was authorized back by the Affordable Housing Act back in 1990, and again, it was revised in 1992. Again, this was to provide states and localities with resources to help those with AIDS or HIV. The activities of primary importance are providing housing assistance and services to assist this population so that they were able to maintain their medication regimens and address their HIV or AIDS. Next slide, please. Okay. Some of the HOPWA activities, again, HOPWA funds will support direct housing assistance. And again, those programs are TBRA, which is tenant-based rental assistance, STROMU, short-term rent, mortgage, and utility assistance, supportive services, permanent housing placement, and so forth. Next slide, please. To be eligible for the HOPWA program, again, it just requires two requirements. And again, someone in the immediate family, whether that's an adult or whether that's a child, they must be HIV or AIDS positive, and there must be documentation of that. And also, too, the household must be at or below the 80% AMI, and income limits are available, based on the HUD website. And again, we're asking that the grantees use the HUD Section 8 income eligibility standards for those HOPWA clients. Next slide, please. And just as a reminder, again, it's upcoming August the 5th. Again, your HOPWA reports are certainly due. And again, for everybody, if you have any questions, certainly I encourage you. Again, you can certainly direct those questions to me, but again, I would ask that you might direct those questions to Lindsay. She would be better able to answer those questions. And again, these are the bullet points that certainly you should be looking at in your HOPWA report. Next slide, please. Most importantly, again, for the HOPWA providers, again, I am out there currently doing the monitoring for all the HOPWA providers throughout the state. So some of the things that, again, you should be looking at to make sure that you are documenting and having in your, anybody that works in the HOPWA program or services HOPWA clients, again, just make sure that these are completed and in their personnel file, the HOPWA oversight training, the Get to Work, a training curriculum for our HIV/AIDS service providers, and last but not least, the HOPWA financial management training report. Again, it's certainly important as I do the monitoring this year that these things are documented somewhere so I'm able to look at them and check them off as part of your monitoring program. And now I will turn it back over to the program manager, Taylor.
Thank you, Doral. All right, so I'm going to take, excuse me, a few minutes to walk through all of the stuff that we do in CAMS. And by we, I mean you all wonderful folks, the grantees. So first, finalizing your project creation in CAMS. So this is extremely important to make sure that we have the accurate information regarding your project. So when you go into your VHSP 2022, 2023, or your HOPWA projects, you will want to go into this first tab that says project information. And you'll want to make sure that all of this information on this slide is correct. So verify it. So you want to make sure that your primary contact information is in here. You will want to make sure that that work cell phone number is in here. That's correct. It's the number that if we went in here and we need to call you, this would be the number to call you. If you put your personal cell phone number in here, you just made it free game for us to call you on your personal cell phone. If you do not wish us to do that, please do not put your personal cell phone in here, but rather put your work cell phone number in here. We prefer it to be a direct line versus your agency line that then you need to press 7 to talk to Melanie or something of the nature. So if you have a direct line, please make sure you put that information in here. Then you'll go down to the bottom of this same project information slide and you will add all the applicable primary service locations. So if you are in the Richmond Continuum of Care, for example, you will have more than one county or city or town that you are serving if you are serving the entire continuum. So you will make sure that you enter all of those down here at the bottom. This just gives us an accurate representation of what counties and cities that you are serving. All right, and then once you update all that lovely information, you will make sure you click the Save button at the bottom of the screen. If you do not select this Save button, the information will not save. If you then exit the tab, this information will not be there. It will be whatever was in there before. And then when you go in, you will have to re-enter all of that information. If you wish to save yourself some time, make sure you press the Save button at the bottom of the screen. All right, the next thing that we do in CAMS is we do our grant agreements in CAMS. The CAMS calls it a contract document, but we refer to it as a grant agreement. So to access your contract or your grant agreement, you will go to the Reports and Communication tab in CAMS. It will then show a screen like this with all of your contract documents, and you will click the one that is the most applicable or the one that you're looking for. Once you do that, you will be directed to this next slide, and then there will be an attachment that you'll be able to click on, and it will open up, and that will be your grant agreement. Please make sure that when you're opening it up, it says your agency name, all those things. We do our due diligence to make sure that it is correct, but you always want to make sure before you sign something that you've read it thoroughly and that it matches what it should say and all those things. So you will then open that up, and you will do one of two things. You will either print it and have your signatory for your agency sign it with a wet signature, and then you will scan it. Or if you all have all that fancy equipment and things, you will go ahead and do an electronic signature on that document. We are not taking type signature, so please do not use a type signature and then put it in whatever the cursive font is on Microsoft Word. Please utilize a actual electronic signature, such as like DocuSign or something of the nature, because it'll put the timestamp and all of that wonderful things. So once you do that and you've either printed it and then scanned it, and now you have an upload that you have, or you've done an electronic signature and you've now saved it as a PDF, you will then go and you will upload it here onto this, slot in CAMS. Once you do that, you will save it, then you will submit it, and then it will port over to our lovely program administrators who will then be able to review it for correct signatures. If you are missing a signature, a title, a date, that grant agreement will come right back to you, because we need all of those lines filled out appropriately in order for us to go ahead and approve that for you. All right, so then next we have our budget tab, which is nicely labeled project budget. And so I'll walk you through how to use, how to submit your budget revision in CAMS. So first, you will enter the total award at the top here, where this red arrow is pointing. You will put your entire allocation that we are awarding you in that box there. If you put the wrong number and then you put all your information in, it won't match and it won't sync up and it won't let you save it nor submit it. So please make sure that that total award matches what you know to be true and also what is reflected in your grant agreement. Then you will go and you will do this little add button on each of the different funding categories that you have. You then will, once you press the add button, you will see a drop down and it will show you all of the line items that that category has. You will make sure that you drop down all of the line items that each category that you have funded has. It is important, and I'm saying this multiple times because many folks don't do it and it gets bounced back to them. It is important that you drop down each and every line item under your funded categories. If you do not drop down each and every one of the line items under your funded category, your budget will be denied and it will be pushed back to you. If you do not intend on using a line item, please enter the amount of $0.00. The reason we have you do that is because you are permitted to move funds or spend how you want in your line items under a funded category. If you do not open a line item, it will not be accessible to you to be able to use at a later date. So, for example, if you are using outreach and you think, I'm going to use all of my money in case management, however, we get a few months down the line and you determine, whoops, I have this random other expense that I'd like to build, but you didn't drop down the other category. You will not have access to it. You will then need to submit a budget revision to open it. Then you will walk through this 30-day process with us again, and you will not be able to submit your remittances in a timely fashion. Please make sure you drop down every line item under every single one of your funded categories. We go in when we review these and we count the line items to make sure you drop down every single one, so we don't have to do the song and dance halfway through the year. All right, once you entered all your amounts, drop down all of your line items, all of that wonderful stuff, you will make sure that the total that is reflected down here matches the total that is reflected up here. If they do not match, CAMS will not allow you to submit it. But once they do match, and they've also matched your grant agreement, you will then be able to select the Save button. And then once you save it, then the Request Budget Revision button will turn into like the accessible gray versus this like less than accessible gray. And then you'll be able to press Request Budget Revision. It will not let you request if you have not saved. So if you're like, hey, Ray, I can't submit my budget revision, Ray will say, hey, did you save it? And then you will say, oh no, I didn't save it. Then you'll save it. And then that button will pop up and it'll be all wonderful. That budget will not port over to your PA until you request that budget revision. So if you save it and never go back and press request, it is sitting on your side, chilling until whenever. Once you press Request Budget Revision, it ports over to your PA and your 30 days will begin. All right, so then we'll switch gears over to remittances. So you need to do your budget revision before it even allows you to do remittances. So that's why we talk about that first. Once your budget revision receives final approval, CAMS will allow you to then open up and start doing remittances. So a remittance, for those who don't know, is how you request reimbursement from us for the expenses that were eligible that you paid for in your project. They are based on your payment date that you pay that expense, not on the cost incurred date. So please be mindful you remit based on your payment date. You should, and it's in your grant agreements, and so we'll go over it here. You should be doing it either on a monthly or a bi-monthly basis. So we appreciate folks doing it monthly. If you have your remittance for September, you would then submit that anytime in the month of October between the October 1st and October 31st. It takes us 30 days for payment to be processed. So please be mindful if you are in need of money, the earlier you submit your remittance, the sooner it gets paid, those types of things. So we are on a 30-day time frame. Next, your federal rapid rehousing has to be spent prior to your state rapid rehousing. It is in your grant agreement. You should spend all of your federal rapid rehousing dollars by March 31st, unless you are using a state rapid rehousing line item only, which would mean your risk mitigation funds and your federal line item. So we have federal rent arrears, federal rent assistance, and federal housing stabilization financial assistance. Those you can go ahead and start using even if you're still spending your federal dollars. If you start to spend your state dollars and it's not for one of those 4 things, before you finish your federal, your PA will kick that remittance back to you and ask you to move that to your federal category so that you spend those down and meet that deadline first. Common errors for remittances that result in denial are missing information. So please be mindful when your finance team reviews and does your remittances that they make sure all the information is there. If you're missing payment information, i.e. check numbers or direct deposit information, whatever the situation is, or you're missing pay periods or staff titles, those remittances do get kicked back. We do need that information, and that starts your 30-day time frame over. So just be mindful. This is 30 days from the time you submit a correct remittance. Another reason that your remittance may get kicked back is because the supporting documentation does not match what you requested in CAMS. I.e., in CAMS, you requested 10,000, but your backup documentation only shows us 5,000. Those 2 things do not match, i.e. we will kick that back and you will need to resubmit. Or in CAMS, you say, I spent rapid rehousing money, but your backup documentation shows it's emergency shelter. You will need to resubmit that remittance. If your remittance is denied for any reason, your program administrator will send a note in that when it gets kicked back, and they will let you know why it's denied. If you're ever having a question about why it was denied, please reach out to your program administrator and they will provide you with the reasoning for why your remittance was denied. All right. So once you have your remittance all ready to rock and roll, this is how you put it in CAMS. You will go into the remittance tab on your project. You will then select the Enter New Remittance button. If this button is not highlighted and you cannot click it, it is likely because your project budget has not been approved. This, excuse me, this button will show as clickable or like a hyperlink or whatever it's called once your budget is approved. So if it's not accessible, your budget is likely not approved. All right, then you will go in here and you will submit all this wonderful information. You will say how much you are requesting in CAMS for that remittance. Please make sure that this, what you're requesting in CAMS, matches the backup documentation that you are going to upload here. And I apologize if this appears blurry for you all. So you will make sure that you submit a PDF version of your remittance documentation. Please do not submit a live form. We will not accept those. It must be a PDF of that Excel spreadsheet. That Excel spreadsheet should be filled out completely, i.e. you should have your agency name on there. It should have the appropriate signature. The new remittance form does go ahead and specify it must be an electronic or a wet signature. We are not accepting typed font signatures. We did for a brief time during COVID. However, now we are going back to the standard financial procedures and requesting that you do a wet signature or a electronic signature. Once you upload that, if you have any notes, please feel free to add those there. They are optional. You don't have to, but if you have some, please feel free to type them in there. Once you've done all of that, you will then select the Save button first, and then you will hit the Submit Remittance Request second. If you don't press that Submit Remittance Request, it will just sit in your on your side, and it will never come to your PAs, and thus your 30 days will never start. All right, so that was the remittance process. On our website, we have all of these wonderful resources for you, and we are going in the process, and some of them we've been alerted need to be updated, so those will be updated within the next 48 hours. But we do have our guidelines up there. We have the new remittance form. We have our eligibility forms. We have the habitability checklist, the required lead-based paint assessment training, the lead-based paint visual assessment form, and the rent reasonableness checklist. You'll notice that the homeless cert is no longer on here because it's no longer required, so that has been removed. Important dates for you all to know and be aware of, and these are more just like important things that are coming up. Some don't have official dates yet. Is we have a couple of Hsnh workshops coming up. One will be specific to youth projects, specifically under our underserved innovations projects. The next one will be a collaboration between the VERT team, which is the Virginia Eviction Reduction Pilot Team, and our team to talk about the differences between VERT and targeted prevention, and when you can use one funding source and when you should use the other. We will also hold our annual COC LPG lead meeting. The date, time, etc. is forthcoming. And last but certainly not least, we will do the Virginia Governor's Housing Conference, and the date and time for that has already been released. It is on November 16th through the 18th, and it is in Arlington, Virginia. The website is up and running, so feel free to click that link if you'd like to register as well. All right, and then switching gears here. So for Housing Trust Fund, and many of you have asked a lot of questions about this, so we wanted to just give a brief overview. So for the Housing Trust Fund Homeless Reduction Grant, this year we did it differently than we've done in most years, and we went ahead and combined it with our Hsnh application. So folks were able to go ahead and submit projects for rapid rehousing and permanent supportive housing. Those applications were scored in 3 different tiers or priorities. And so basically the priorities are listed out like this. Priority 1, if your COC or LPG scored above a 70 on the Hsnh application and also submitted an eligible rapid rehousing and or PSH project, you were priority 1. Priority 2 is if your community scored above a 70 and either the project needed to be tweaked just a little bit because it might have just needed 1 or 2 things to become eligible, or you didn't submit any projects, you would be in tier 2. And then all the other folks would fall in priority 3. The application is forthcoming. It'll be sometime this fall. And during the application time, you will be able to submit for underserved populations innovations projects. And then also you'll be able to submit, if you didn't, PSH and rapid rehousing. You will also be able to submit additional PSH and rapid rehousing projects if you only submitted 1 or 2 or however many. You can either increase your ask that you submitted already or submit new projects as well. Any additional funds or new applications will be scored in that priority 3 for PSH and rapid rehousing. All right, and many of you should already know who your lovely program administrators are, but in case you do not and you are new, the regions are broken down as such. So Will Kerner is region 1 and they are all listed here. Desiree is region 2. Sarah Foote is region 3, and Ray is region 4. And then for all of our wonderful Hopper providers, your program administrator is Darrell Wilburn. Hopefully you all know who those folks are. If you don't, their contact information is located on the last slide of this presentation. So you'll be able to reach out to them either by phone or email if you have not already connected with them. All right, so now we'll go ahead and open it up for the Q&A session of the implementation webinar. So feel free, if you would like, you can come off mute and ask your question out loud, or you can utilize the chat feature.
So this is for kids, and our question is still trying to get confirmation around the paper that has to be submitted, knowing that we are funded both for ESG funds from a specific city and by our rapid rehousing federal award within our VHSP grant. So I think that there were some questions that we've answered in the chat that have gone back and forth, but hoping you all can at least understand why we don't believe this is possible.
Hey, Andrea, I'll let you grab that question.
I'm sorry, can you repeat that question really quick?
So Andrea, we had started the conversation in the chat. So we received ESG funds from a specific city, Norfolk. And then we also receive ESG funds through our rapid rehousing portion of our VHSP grant.
Mm-hmm.
So we're not sure. We've done it with a reporting group.
Right, that can no longer be done.
Right. So how are we going to do this?
Are you talking about for this year?
Well, for this year and for next year.
Next year, it has to be 1 project. You have to have a VHSP ESG project.
But how? I don't understand how we could be expected to do that because, of course, Norfolk would not be inclusive of households that we're serving throughout our region.
I mean, like that. So 1, it's a HUD requirement that we haven't been enforcing. HUD is now enforcing it. So you're going to have 1 ESG project for the area, and everybody who is getting funding through that is going to have to use that same HMIS project. Your ESG for the city of Norfolk is going to have to be a separate project in HMIS. how you operate them may be together, but in HMIS, they have to be separate projects.
So they are separate projects, but then when I go to submit my statewide caper, I need to include those from Norfolk.
Then they need to be in the state ESG project.
But someone
Because the problem that they're having is duplication of service, that you have more than one person. And if there's one project, HUD is saying that they cannot then take out, they're trying to unduplicate services.
and we understand that, and we use the state funding for, I believe, I'm not going to swear to this, but I believe our state funding is being used for the direct assistance, and our Norfolk Rapid Rehousing Program is being used to provide the case management portion for Norfolk residents only.
So I am either going to say it's going to have to be entered into two projects, or if or you set it up as an ESG. No, you're going to have to set it up as two projects. There's no other way to do it.
Hey, can I jump in real quick? This feels like it's way more extensive. Like it just is a unique for kids thing. I think it might be better for this to go offline so Andrea can kind of help explain it. And then Juanita, you can talk about what your concerns are, because it sounds like you're asking how to do it. And I think it probably is going to be an offline conversation. I could be wrong, but just listening, I have no idea what either of you are talking about. And I'm pretty sure another 128 people feel the same way. So it's probably going to be a better offline conversation.
We do have the solution for this year. So send me an email and I will send you the solution for this year.
And that's fine. And Michelle, I certainly do appreciate you saying that it could be an offline conversation, but according to the chaps in the side, we are not the only ones being impacted by this. So I do think we need to publicly come to the solution and make that available to everyone.
I would
And
agree.
the only solution is one project.
Yeah, we had a long, extensive conversation about this in-house, where it came down to HUD has a requirement. We haven't been following it. We have to follow it, period. So what we're trying to do is figure out how to help people understand that it has to be one project. Whether we agree or not isn't the issue. It's that HUD has this requirement. We need you guys to follow that requirement so that we are also in compliance. It sounds like it's a lot more extensive than what this conversation would allow. And so if there are multiple people, because I don't think everybody on here is an HMIS person. In fact, we have 27 COCs, so I would assume 27 max are on here. And so with that being said, it may be a better conversation for offline. It doesn't mean it's not important. It doesn't mean multiple people don't have questions. I just think for this moment, we probably need to take it offline and really go through what y'all need versus what we are able to offer. And I think Lindsay has to be a part of that conversation too, as our policy person.
Totally understand, totally willing to have that conversation. I think that for us though, we hear you saying that this is a HUD rule and you have to do it. But at the same time, we also need to know that the state is advocating when it's not possible to do it. And that's what we were having our conversation towards, is sometimes HUD comes up with rules that just aren't possible in the real world.
And one of the things for everybody to know, this has been a rule that has been in place. We did have somebody reach out to us who was submitting their caper very early. So we found out, we've been working, trying to find out the solution for a while now. For about 3 weeks, we've been working on this. So we finally got a solution for this year. And then once we got the information back from TA, we were made well aware that this has been in place for some time and that HUD is now making sure that it's enforced. There will definitely be more information to come, and the rule and all that stuff. But I needed to put it out there as you all are getting these projects started for July 1st, that there's not going to have to be a lot of, re-entering data into a different project, that, figuring out how to get it set up as soon as possible. Okay, I think I had another question.
Real quick, Andrea, before you go to that, based on what Andrea just said, I just want to make sure it's clear. Other states have been doing this, and other grantees have been doing this. So for us to advocate for something we should have already been doing, and I think some of you may have had this experience before where we say, you've been doing something incorrectly, going forward, we need to do it right. It's never a good idea for you to say, but we've been doing it incorrectly, we want to continue. It's a better idea to try to figure out how to do it right. And I'm just saying that we are one of the few that aren't doing it correctly.
Okay, so we had another question. Does the COC prepare the CAPER for all ESG rapid rehousing projects or in a COC, or does the grantee do this and submit and stage? So if a grantee gets direct ESG from us, the grantee does that. The only way it would be at a COC level is if the COC is the fiscal agent and then subgrants out, and then it would be who we grant to directly. I know Charlottesville is an example of a city that receives is the fiscal agent, and then they have MOUs or subcontracts. However, like in that instance, it would still need to be the one project. But in most of the cases, it is the grantee who submits the CAPER. Okay, so if an agency needs their own project for their specific reports, would they have to enter data into projects? If you don't want to look at it, yes, I see this issue. So that I am going to have to work with our team on our reporting requirements for ESG semi and annual reports, because that might be something we need to change and have one ESG CAMS report. But each grantee can receive ESG too. We'll put more guidance out about any reporting needs.
Okay, Andrea, it's Erica. I was
Yes.
just, I was kind of asking a question, but also making a statement.
Okay.
Just that because we currently enter people at St. Joseph Villa in multiple projects just because of reporting, and different people require different things. I was just clarifying as far as if it's multiple agencies using the same pot of money or the same project, and they were all entering data in that, but a specific location or locality, let's just say Norfolk, needed something different, that agency could just potentially have their own project that not necessarily would be ran for your reporting purposes. And I saw that Anthony was talking about creating custom fields, but when we do that in HMIS now, when it pulls it, it says that it's pulling for multiple projects, and you're saying that it will not accept that, correct?
Right. So it cannot be multiple projects. I knew there was going to be some questions. I don't think I expected there to be this many, because in the past there have only been a handful of either agencies or locality or COCs that did have multiple projects set up under one ESG grant. And this isn't saying that you can't have multiple ESG grants. It's just, let's say St. Joseph's Villa receives ESG. That one ESG needs to be one HMIS project.
Correct.
No matter who they're serving. It doesn't mean that in one COC there can only be one ESG project. So I want to make sure that's clear as well.
Okay. Okay.
Yeah.
Understood.
Yeah. Okay, so there will be information coming out, and there may be a future, if this does seem to be a significant issue, we'll either set up some meetings by the COC who's having trouble, or we'll put out further guidance.
Andrea, it's Juanita, one more moment. I just want to be clear that what our struggle is when you're in a COC that has multiple cities,
Mm-hmm.
then how do you do that? Because for us, Norfolk, of course, is not entitled to the information for the Chesapeake families that are in the state VHSP ESG grant. And so I think that's the big issue, is how do we divide it up to be both at a local level and at a state level?
And that is specifically the reason that, based on the reading from the TA provider, that HUD requires this, because it must be using one project ID to separate those out.
Right, but then if that's the case, then what seems reasonable is that we don't provide a CAFR to the city. And that,
Well, that's going to be required.
I know, but then the CAFR is collected at state level. I mean, there's no, if we're only allowed one project, that's the only solution. So I don't know what we're going to do. This is.
We'll have further conversations offline, and we can work with the planning council too, with your HMIS system, to help get resolution.
All right, perfect. Thank you, Andrea, for answering those questions. Did anyone else have any questions that were not regarding the SAGE ESG CAPER report? And I think we answered all of the ones in the chat. I think if we did miss your question for some reason, or it was by mistake, please make sure you just reach out to your program administrator and send them the question, and they will make sure to provide you all with the appropriate guidance. All right, so we will go ahead and conclude that portion of the implementation webinar. So here's the contact information for all of the staff who are here today, or not here today, but all the folks on the team. So if you have a question, please make sure you reach out to your appropriate PA, and they will go ahead and get that answered for you. All right. So I did want to conclude today's presentation with a farewell to Nichelle. So this is last, but certainly not least on our agenda. So we wanted to just take a brief moment to thank Nichelle Carver, our fearless leader, for serving the Commonwealth and our communities most vulnerable for the last 15 years. The HSNH team greatly appreciates your leadership, passion, and all of your support. The foundation you have laid will continue to influence the work of this team as we continue to fight to end homelessness. And with that, a huge congratulations on your new position. Nichelle, did you want to say a few words?
I thought I did, but I don't want to say too much because I don't want to. Just thank you. Thank you, everyone. I've really enjoyed working with all of you. I've gotten to know a lot of you really closely. And I know y'all are going to continue to do great things for Virginia. So thank you.
All right, so we will hold the call open for just a few more minutes. So if folks want to continue to put their well wishes in the chat, or if you wanted to come off mute for a second, you could. And then so we'll hold it open for the next 3 minutes, and then we'll close out this call.
Hey, Nichelle, this is Mary Beth. I just want to say thank you from the Lenowisco District. Thank you for teaching us and inspiring us to do better and to be better. And we wish you the best. You are a rock star.
I'm real mad because I've been crying like for a week, and I was like, I got it today. I was running late. Y'all didn't hear me in the beginning, but I came to DHCD. I was late my first day. I've been late most days in this 15 years. And so it was very fitting that this morning I was late. So I thought, oh, that's going to lighten me up. I'm going to be good because I'm just always late. It's like a regular day. So yeah, I had no idea seeing y'all's faces was going to make me feel things. So anyway, I'm going to be on the federal level. So hopefully I'll see y'all. I'm going to try to come and talk to the Virginia Governor's Housing Conference. So if y'all can come there, I'll see you. Hopefully they'll approve the request for me to speak there. But anyway, I just appreciate everything y'all do. And I have said it, this team is an amazing team. So I was just lucky enough to be a part of it. I think people don't realize they're the ones that do all the hard work, and I get to sit back and, you know, talk about it. So y'all are in great hands with the folks that are still here. And just know I'm going to miss y'all. I'm going to miss so many things. This implementation session, Juanita knows I love her, and I've known Juanita for the whole 15 years I've been here. And Juanita never disappoints, ever. And I love it because it makes things feel more normal. So y'all take care. Everybody enjoy the rest of your day. And we appreciate y'all taking the time out. Thank you.
Yeah, it's like a 2 day. Michelle, I still love you too, and we'll always honor working with you.